Welcome to the conversation. Dr. David Klein of the Stages of Life Institute in Longwood. We'll give you contact information a little bit later in the discussion. But I've been around Dr. Klein long enough to know, and I've been around talk radio long enough to know, that probably one of the most misunderstood things in the world is diabetes. So, doctor, let's get to the bottom line. What really constitutes diabetes?
Okay, here's the drill right here. Okay, if you ask a physician to define diabetes, he or she might say that it's a blood sugar over a certain capricious amount. Whether it's 110 milligrams per deciliter, could be 90, could be 140. The definition has changed over the years. But something hasn't changed, and that's a misunderstanding as to what the disease really is. It's not a number. It's not an A1C. It's not a blood sugar. It's not a, I get up in the middle of the night to pee disease. It's a disease of this. And understand this well, because if you do, you stand a reasonable chance of either avoiding it or fixing it. If you don't get this, you're not going to do well. Diabetes is a disorder of insulin receptor action. Now, what does this mean? It means that your insulin levels are floating around at whatever they happen to be, 2 to 10 micrograms per deciliter, picograms per deciliter. It's one of those sorts of things where the insulin level is supposed to be low relative to your blood sugar. Why? Because insulin not only lowers blood sugar, but it also puts fat on your stomach. But something magical happens. It happens as a result of our diet, less so for our genetics, but really this is an environmental dietary issue, and that's that we don't have enough of certain micronutrients in our diet. The insulin receptors become resistant. This is called prediabetes, and it happens 10, 15, 20 years before you're diagnosed as having diabetes. Well, guess what? Wake up. You have the disease, you just don't have the blood chemistries that demonstrate it yet, which is another way of saying is the animals have not yet entirely left the barn. So here's what we need to do. It's a disorder of insulin effectiveness. And what is it that damages the insulin? The insulin floats around. You would think that because you have diabetes, you don't have enough insulin. I have run over 15,000 insulin levels, and this is just about never the case. You'll find one or two juvenile onset diabetics that have no insulin, okay? The joke is many of the juvenile onset diabetics have lots and lots of insulin. Why? Because they were misdiagnosed as having insulin deficiency, and that's not the case at all. It's a resistance issue. So where does this occur and why does this occur? Well, the insulin receptor is a very complex receptor. It takes 2 insulin molecules to trick and trigger this thing anyway. Not that that really matters, but it is kind of interesting. But just on the inside of the cell are a series of proteins and enzymes, one of which is called AMPK, that becomes damaged when you don't have enough vanadium and you don't have enough chromium. So the first 2 places where you should treat somebody that's seeing weight gain, the first place that you suspect for metabolic syndrome X or prediabetes, is to give them the appropriate amount and ratio of vanadium to chromium. And not all vanadium and chromium are the same. These are transition elements. They have what are called stable d orbitals. What does this mean? It means they can have different valences, which is another way of saying they have different charges. And when this occurs, they may or may not work for you. So they have to be the appropriate moiety in order to work at all. And so this is a very, very important point. If it bores you, I'm sorry, but you need to understand that, because if you're gaining weight, if you are of just like everybody else in our society, you can't understand why you're gaining 3 to 4 pounds per year, more than likely it has to do with the insulin receptor. So can you cure diabetes? No, what you do is you fix the underlying nutritional difficulty, the insulin levels drop, the weight drops, and it goes away. Is it cured? No. It's not cured. It's a matter of fixing the environmental dietary issue that causes this. So what is diabetes? Diabetes isn't a shortage of insulin. You can't have a shortage of insulin and have too much insulin at the same time. That is nonsense. When you're looking at an A1C, because that's what the family doc thinks you need to know, all that tells you is whether you had one bad day in the past 90. You already know that because you had a dish ice cream. Okay, so stick the money back in your pocket, and instead of getting an A1C determined, ask your doctor to do this. Get an insulin to glucose ratio. You do this, you're going to get a much better handle on what might be a curable, controllable, or preventable situation than to simply decide what type of stick you want to get to control your diabetes in the morning. Well, I'd rather get the one touch. I'd rather get this. No, you really don't want to be there. What you want to do is you want to fix this issue before it becomes critical. Well, what else can you do if you think that you have diabetes or if you think you have prediabetes? Berberine. Berberine also will influence the insulin receptor, chases insulin levels down while at the same time lowering blood sugar and triglycerides. Now, understand this is a derivative of a bush. It's an herb. Okay, will it make you nauseated? Yeah, it's unfortunate, but it might actually cause some weight loss. I hate when that happens. Okay, so what is diabetes? Diabetes is not a disease of insulin production. It's a disease of excess insulin due to insulin receptor resistance. That's what it is.
So people are getting up in the morning and they're taking blood from their fingertips or wherever, and it hurts like hell, and therefore a lot of people just don't do it. But they're taking a sugar measurement. Is that what they're doing?
Pretty much. That's all they're doing.
And so they pretty well think, oh, yes, it's too high. I need to go see the doctor.
And get more insulin, typically. Okay, and so what happens is insulin is not the issue. So we have a technique in the office called a CGM, and what we'll do is we'll pop one of these things under the skin, leave it in place for 3 or 4 days, and it does a blood sugar determination every 5 minutes.
Wow.
Okay, so it'll pull over 700 blood sugars over the course of the 72-hour period, sometimes a little bit longer depending upon our schedule. And then you overlay these data to see where the issues are. It's not enough to know that you wake up with a high blood sugar. It's not enough to know that you go to bed with a high blood sugar. It sure as heck would be nice to know that it happens between 1:30 and 3:30 every afternoon so you can figure out what the heck you're doing at noon, okay, because that might be what's setting things off. So what is diabetes? Again, it's not a problem of blood sugar. It's what the body does with the insulin. And the answer, oddly enough, isn't more insulin. The answer is typically less insulin. So in my practice, what I try to do very, very hard, and I'm quite successful at it, is to get people off of insulin. They lose weight. Their blood values get better. That their family docs think I'm crazy. I'm doing some type of voodoo medicine. It's actually very, very centrist. It's very scientific. It's well placed in the scientific literature. And when it works, marvelous. When it doesn't work, not everything works.
Mm-hmm.
Okay.
When somebody is suffering from, quote, real diabetes, what is causing the problem with the kidneys and what is causing problems with the optics?
Okay. The blood sugar, will then degrade in odd ways. Your body is always looking for ways to get rid of something that is in excess, something that becomes a problem for it. So when blood sugar goes much above 130, 140, the body starts looking for alternative means and mechanisms to get rid of it. So if it can't chase it into the cell, which is why you get fat, the insulin chases it into the cell, so you blossom out. But that's not enough. Oh, no. So then your kidneys will start excreting it. You'll start dumping it into your urine. That's why you get up in the middle of the night to pee. It's because your body is trying to get rid of the sugar. The sugar is an osmotic diuretic, pulls water out, and off you go. So you're thirsty all the time, and you end up with sweet urine. The Greek diabetes, sweet pee. Guess what? That's what it's all about. So where does the damage occur? The damage occurs when the body produces something called aldose, from the blood sugar. So glucose degrades to a 3-carbon sugar. It's neurotoxic. That's the first thing. The second thing is that the excess sugar, and oddly enough, the excess insulin causes blood vessel generations called angioneogenesis. Very interesting. And so that's what causes the eyesight to get lost. So the insulin itself is, again, your enemy, not just the blood sugar, not just this, not just that. It's a combination. Your body is out of balance. You have to fix the balance. And when do you start this? You don't wait until you're 300 pounds to realize that you got a problem. Your weight should be this, and there's not going to be anybody listening that's going to like me. But the way you figure this out, it can all be done in the head. For those of you that don't have a cell phone with a calculator, a man, at 5 feet tall is 106 pounds, and then 6 pounds for every inch over that. That will give you your insurance weight. So a man that's 6 feet tall would be 172 pounds. When was the last time you saw that? When you were in high school? No kidding. That was the last time you were healthy. A female, 100 pounds at 5 feet tall and 5 pounds for every inch over. So a 5'6" female would be 130 pounds. Now, when you get 30% over this, you are now called morbidly obese. That means sick, sickly. Okay? Bad news. Not only is it going to increase the damage to your knees, your ankles, your back, and everything else, but it costs you more than your insurance premiums. Okay? And if you think that's a joke, look at the people that had this Affordable Care Act hit, where now all of a sudden their health care premiums are 2 and 3 times as much because it's that much more affordable. How did this happen? Because the doctors had to report your BMI.
Ouch.
So what is diabetes? Now you know.
All right, very good. In a future show, we're going to bring up the complications that many of you cause yourself by hearing a little bit of information, running down to the health food store, and stocking up on vanadium and chromium and making your own mixtures. Yeah, you should be seeing the doctor, okay? And the right doctor. Robin, we'd like to go to the stages of life.
Well, give us a call at 407-679-3337. Check us out on the web at stagesoflife.net. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And our office hours are Monday through Thursday, 8 to 5. The health store is open during office hours. We invite you to come on in. And we're also on Facebook at Stages of Life Medical Institute.